Welcome to the Thurston County Board of Health meeting, December 9th, 2025. Meeting will come to order at 3:47. Let me know if you can't hear me as my voice is giving me a little trouble. And first thing on the agenda, I wanted to welcome Dr. Valona, our new health officer. And we'll have time to ask questions later. First item on our agenda is approval of our Board of Health, December 9th, 2025 Board of Health meeting agenda. Everyone has had a chance to look at that. I will take a motion if you are so desired.
I move to approve the agenda.
All right, and a second. Thank you so much, you two. And all in favor?
Aye.
Aye. Any opposed?
Aye.
Thank you. All right. All is in favor. So next item we will review is the October 14th.
Can you check in on the iPhone 2 image?
I believe it's Ray.
It's
Yeah, this is Ray Peters on here.
Recognize the voice for the minutes.
Yes. All right, next item on the agenda is approval of the October 14th, 2025 Board of Health meeting minutes. Is there a motion to approve that?
I move to approve the October 14th meeting minutes.
Thank you, Commissioner Klaus. Is there a second?
I'll second.
Second, Lynn Nelson, thank you. All in favor?
Aye.
Aye.
Any opposed? All right, so moved. So next item on our agenda is the proclamation for National Influenza Vaccination Week, just in time. Our speakers are Laura Cooper and Wendy Hurst from Public Health and Social Services. Welcome.
Thank you so much. Thank you so much for having us. I'm Laura Cooper and I'm a nurse manager for Thurston County Public Health Disease Control and Prevention team. Thank you for recognizing the significance of flu prevention and prioritizing this initiative. To speak more about the importance of this proclamation, I would like to introduce my colleague, Wendy Hurst, and she has been a valued member of our team. She has done a lot of outreach and immunization clinics, and she will take it over from here.
Thank you very much, esteemed council members. Many of us have customary rituals as we prepare for fall and winter season. We assess our winter gear, weatherproof our houses and our cars. Getting ourselves ready for the winter should also be part of that ritual. As the winter weather takes hold, we are more susceptible to colds, illnesses, and yes, the flu. While we can't always avoid a common cold or other respiratory illness, we can take significant steps toward staying healthy this season by obtaining a flu vaccine. The flu is more than a seasonal inconvenience. It's a serious and unpredictable disease that tragically claims thousands of lives and results in even more hospitalizations each year. Rates of infection from seasonal influenza are highest among children, but the risks for complications, hospitalizations, and deaths are highest among adults aged 65 and older and individuals with underlying health conditions such as diabetes, heart and lung disease, as well as HIV. While common sense precautions like frequent hand washing and staying home when ill are important, the single best way to protect ourselves and our communities is through vaccination. National Influenza Vaccination Week is a crucial opportunity to remind all Thurston County residents that there is still time to get vaccinated and to underscore the vital importance of this preventative measure in safeguarding public health during the height of the flu season. Typically, in our communities, peak influenza activity occurs December through March, most frequently in January or February. This week presents a window of opportunity for us to remind all residents of Thurston County that immunization is the best intervention to prevent or at least minimize the impact of the flu on the health of our community. We strongly encourage those who have not received the flu vaccine to do so. Vaccines are available at many local pharmacies, or you can visit Thurston County Respiratory Dashboard, flu.gov, to find vaccination sites in our community and to stay informed. As flu viruses continue to circulate and pose serious health risks each season, we can take a collective stand to promote Thurston County's health. By getting vaccinated, we not only reduce our own risk of illness, but we also create a healthier, safer environment for our families, friends, and our neighbors. Thank you.
Anybody have any questions for them?
Thank you. I have a question. As you know, you were talking, I had this kind of flashback. So pre-COVID, public health used to do a lot of, would offer vaccinations for county employees. They would have it in different locations. And of course, because of COVID, kind of stopped. And I'm wondering, is there any plan to bring that back?
I don't know that we have the capacity right now to do that, and I think that that was probably larger a county HR sort of thing at the time, when that occurred, but we certainly are looking for ways to be able to do immunizations in the community.
That's great.
Research that and work with HR if we need to, but we can get back to you.
Yeah, I always feel like the easier and more convenient, the better, right?
Yeah.
Get more people protected. Yeah, clerk.
I appreciate the fact that folks should do it for the vulnerable people or people around them, even if they personally feel invincible. I think that's the whole idea of community health, right? And so could you speak a little bit to, I think, from these questions, where do people access the flu vaccine? How much does it cost? How does it happen? How do you get immunized?
Generally speaking, you can obviously go to your PCP, your primary care provider, sorry. And most flu vaccines are covered by insurance because they are on the recommended list of vaccinations throughout the nation. And as well with the majority of pharmacies. Just call and find out if they accept your insurance, and they will get you vaccinated.
Thank you.
Thanks for the question.
Anyone else?
So I have to bring it up that in this time, there's a lot of vaccine hesitancy
Yes.
and misinformation, so much information out there.
True.
What would you recommend for people who might have some concerns about getting the vaccine and don't have any plans to? What else can they do? Can everybody do? That doesn't include vaccines to protect themselves and others.
I think Wendy mentioned good hand washing, wearing a mask when you're ill, staying home when you're ill. Those are good things to do if you're not feeling well and if you are preferring not to vaccinate.
I must add as well, coughing or sneezing into your sleeve where the germs can desiccate and die as opposed to into your hands.
And there is antiviral treatment for flu if you get it in the first 48 hours, so.
And right now we do have available to purchase the combo testing for COVID and flu, correct?
Yes.
Both type A,
Is that
Pharmacies,
available?
yes.
Yeah, okay. It's good stuff.
It is.
It gives you a lot of information, so.
Yes, thank you.
I have a question. Do we know anything yet this year about vaccination rates compared to previous years, specific for influenza?
Yeah, we don't know yet.
That's what I figured.
We know that the past 3 years, our influenza rates have gone down. This year, the last I saw, Thurston County was at about 21%. But that's early in the season, and we've been hovering around 33 to 35% over the past 3 years.
At this point.
Yeah.
there's still time.
Mm-hmm.
I have 2 school-age kids, so they're already coming home all snotty, and it's like, oh no.
Usually hits at basketball playoffs.
Yes.
That makes sense.
Basketball and wrestling.
All right, if there are no further questions, let's read the proclamation. And would you be okay starting, Lynn?
National Influenza Vaccination Week. Whereas influenza is a contagious respiratory illness that can lead to serious complications, hospitalizations, and death, particularly among children, older adults, and individuals with underlying health conditions such as heart or lung disease, diabetes, and HIV, and
whereas annual flu vaccination is a safe, effective, and widely recommended strategy to reduce the spread of influenza and protect the health of Thurston County residents, and
Whereas during the 2024-25 influenza season, between mid-December and early February, influenza accounted for nearly 10% of all hospitalizations and emergency department visits in Thurston County. And
whereas there is time in the 2025-26 season to make an impact with vaccination to reduce hospitalization and improve outcomes among the community, and
Whereas increasing flu vaccination rates helps reduce strain on local healthcare systems, preserves emergency capacity, and supports community resilience during respiratory illness season. And
Whereas public awareness campaigns and community outreach, especially in underserved and rural areas, are critical to ensuring equitable access to flu vaccines and accurate health information. And
Now therefore be it resolved, the Thurston County Board of Health hereby proclaims the week of December 8th through 12th, 2025 as National Influenza Vaccination Week in Thurston County. We encourage all residents to get vaccinated, support local health efforts, and help protect our community from the spread of influenza. Adopted this 9th day of December, 2025.
great. So speakers and everyone are invited for a picture. Thank you. So we do not have any routine public comment for today. So we will now hold a public hearing related to the 2025 Thurston County On-Site Sewage Management Plan. in accordance with RCW 70.118A and WAC 246-272A. And Season Long has graciously come again to explain the actions requested of the board before public comments begin.
And I'll just jump in really quick. Sorry, Jennifer Freiheit, the Public Health Director. When I say my name is Jennifer, I trip myself up because I'm like, why did I just call myself Jennifer? This plan was presented and proposed to the Board of Health during the 10/14/2025 monthly Board of Health meeting, where a public hearing was approved for this December monthly meeting. And yes, Season Long, our Environmental Health Division Director, is here to provide information regarding the public outreach efforts and that were made before we returned to the Board of Health today, with an addition of 6 or so comments that just came in today, which are not on the slide, but Susan will address those as well. So, turn it over to you.
Appreciate it. Good afternoon, everyone. I'm Susan Long, Environmental Health Division Director. So today I will provide a brief overview of the updated Thurston County On-Site Sewer Management System Plan, also known as the Local Management Plan, and highlight our efforts to solicit and respond to public comments. Changes made as a result of the public comments can be viewed and track changes in the plan, which is available on our website. Next slide, please. Thank you. The on-site management plan establishes a shared responsibility between septic owners and the local health departments. This plan outlines the county's responsibility to ensure there are resources and services in place to support this work. Additionally, this updated OSS management plan ensures the county remains compliant with new state requirements while continuing to improve septic system management and protect water quality in our community. There are 6 categories of recommendations outlined in the plan: septic to sewer planning, designation of sensitive areas and marine recovery areas, database and dashboard development, climate change planning, quality assurance control, and county-led septic-related programs. The plan has been open for public comment since mid-September. EH staff presented the plan at the Henderson-Nisqually Shellfish Protection District meeting, the Thurston County Septic Professional Summit, and the October Septic System Self-Inspection classes. We also emailed requests to review the plan and provide input to our local septic system and water quality partners. We emailed 134 Thurston County certified septic professionals. We posted it on social media in September, October, November, and December prior to the public hearing today. And as of today, we received 3,483 views on Facebook. We posted flyers with QR codes to the OSS Management Plan at public comment webpage at the Environmental Health Division front desk counter and the Building Development Center here at the atrium. The OSS Management Plan website was viewed 181 times, and we received 28 public comments as of 11/14 and 9 additional comments since then, which were either submitted on the public portal or directly received by staff. Here are some examples of the public comments we received. The public comments primarily fell into one of 2 categories: a belief that the plan would increase cost to homeowners and a belief that the plan would increase regulations over septic systems. The feedback from the public resulted in the following updates. We made updates to grammatical errors, spelling errors, and we clarified language. So next steps, we are currently at phase 1, adoption of the 2025 OSS Management Plan update. Today, we are holding a public hearing and staff are requesting the Board of Health review the plan, including recommendations which act as a framework/outline for all the ways we could promote septic system management in the county. By adopting the plan today, you'll be providing staff direction to work with the Board of Health and our community partners on phase 2, which is prioritizing the plan recommendations and adopting funding mechanisms to support and implement that work. Phase 3 will be prioritizing designation of marine recovery areas and sensitive areas, and phase 4 will be continuing to build on our existing framework. And then step 5, which is in here, every 5 years we'll review the plan per WAC requirements. So with that, I'm happy to answer any questions.
There are no questions for Susan, then I will open up the public comment. Ms. Peter, any other comments before we start that? Alrighty.
And there might be some additional people online that we can call after you call everybody on the list.
Okay. I'll let you help me navigate that part. All right, so I will just do sort of our standard ground rules before we start, and then I'll call you guys up at a time. So Thurston County Board of Health welcomes comments from the public at all meetings. The following are guidelines for public testimony to ensure they are appropriate and do not take advantage of the televised nature of the meeting. All individuals testifying will provide their name and address. Testimony will be addressed to the Board of Health members, not to the audience, cameras, or staff. Cell phones will be silenced. No response is provided by the Board of Health following testimony. As needed, the Board of Health clerk will follow up with specific items. Speakers are limited to a total of 3 minutes. The timer is displayed on the wall to the speaker's left, but we're happy to give you a cue. Speaking time may not be shared between individuals. Board of Health reserves the right to restrict an individual's opportunity to address the meeting for a good cause. Lewd, offensive, inflammatory, hateful, defamatory, or discriminatory comments will not be allowed. All materials provided to the Board of Health may be considered public record and subject to public release upon request pursuant to the Public Records Act, Chapter 42.56 RCW. No outbursts of any kind, no comments that are commercial in nature, such as promotion of a for-profit business. So we have 4 people signed up, and the first person who signed up was Betsy Norton. Welcome. Hi.
My name's Betsy Norton. I live on 1405 Evergreen Park Drive Southwest in Olympia. And I am a birder. You may ask, why is a birder talking about septic tanks? And obviously, it's the same, we say so for the same reason that we comment on the comprehensive plan, and we sometimes weigh in on permits, because we're trying to conserve habitat and ecosystems for our wildlife. Our wildlife, as well as people in the county, are impacted when we have toxic algae blooms and low dissolved oxygen in the surface waters. When I have asked people why this is the case around here, typically they point to decreased water volume and failed septic tanks. So I'd just like to connect up the increasing density from the Thurston County Comprehensive Plan to your on-site septic program updates. I noticed that while the county wants to enable more housing options, which is fine, they did not add into the comp plan items to strengthen the environmental protections needed as a result of this increased density, particularly protecting the volume and quality of surface waters, which are very much dependent on the volume and quantity and quality of the local groundwater. I hope the OSS program will be able to fill in these gaps. In particular, there are 2 types of expanded density I hope your program will address. One of them is attached or detached ADUs, up to 1,000 square feet. I live in such an abode, as do many of my neighbors, whose family size ranges from 1 to 5. It's not an extra bedroom, it's a home. And it has the same water requirements as a home. If this expansion triggers a surge in ADUs, it could double the density of families living in the rural areas. Each ADU carries with it the potential for doubling of groundwater consumption, the potential for lower aquifer recharge due to more impervious surface, a potential doubling of wastewater volume. So I'm suggesting here that the OSS program find a way to use ADUs as a way to perform inspections of current systems and provide support for rural residents who need to maintain or upgrade their septic systems. The aim for me is to reduce the untreated wastewater released to the local environment and increase the volume of properly filtered water recharging the groundwater source. The second kind of expansion is cluster subdivisions with density bonuses. The concentration of housing in one area is fine, but it could present the same risks as the ADUs, multiplied by the size and the concentration of the subdivision. So I hope the OSS program requires the latest and best community wastewater treatment to be used for these developments. Well-performing new systems should reduce the risk of recharge loss, which robs the surface waters of volume, and reduce the likelihood of untreated wastewater overflowing into the local ecosystem, which is what causes the toxic algae and low DO. I'm very glad to see also in your plan that you're responding appropriately to the challenges of climate change and adding those into all your calculations. Thanks again for your hard work and your protection of the environment, and by extension, protecting the wildlife and all of us. Thank you.
Thank you. Our next commenter is Christina.
I'm gonna defer to Jesse first.
Okay, Jesse Simmons first.
Hello, everybody. My name is Jesse Simmons. I represent the Olympia Master Builders. We're about 500 members in the home building industry. Everybody from builders to associate members and everybody in between. I did have a whole letter. I did submit the letter and everything, so you have copies of that, and I have about 5 copies here. So I won't dive to that too much. Basically, I just want to summarize it as our concerns, our industry concerns all center around cost. And a lot of the elements in this plan do impact the cost of building housing and buildable lands and things that kind of conflict with our housing goals as a community. So I just want to make sure that there's a balance there in this plan and make sure that we're not overburdening new development, because every $1,000 added to the cost of new development prices out about 2,700 Washingtonians, which translates to about almost 1,000 Thurston County residents. And so the higher the cost, the more people we price out. In my letter, I did recommend some compromises and some solutions. Ultimately, any expansion of marine recovery areas should be first preceded by economic impact review, making sure that how much cost it's going to add, or if it's going to be a burden on new development or take away buildable lands. Also, we should establish a predictable septic to sewer conversion timeline by integrating a sewer conversion schedule map on the county's capital facilities plan. And then protect buildable lands through a balance between the OSS plan and then what the buildable lands report says. And so we need to make sure that is a balance and we're not reducing buildable land capacity so that we can meet our housing goals. Those are just a few of the things that are in my letter. But ultimately, I think if the plan does pass or you implement this plan in the future, I think we should include builders and system professionals in an ongoing oversight. So maybe create a builder and stakeholder advisory panel to participate in the annual OSS program reviews. And so I just want to make sure that, again, there's a balance here. I do understand the need to protect public health and the environment, but also we are in the midst of a housing crisis among many other crises. But the linchpin to solving just about every crisis that we face is housing, affordable housing for that matter. And so we need to make sure that we can keep housing affordable. Thank you.
Thank you for coming. You want to come, Christina? All right.
I was gonna wear 2 hats today, so that's why. Good afternoon, Christina Janis. The hat I'm wearing now is going to be Thurston County Realtors Association. I'm the co-chair of the Government Affairs, also co-chair for OMB. But these are some messages from our current president, Mark Kitabayashi, that couldn't be here today. He's just asking the board to consider to be other perspectives on this, as Jesse mentioned. The cost to homeowners, I for one have an OSS. I can afford possibly annual inspections and stuff, but I live in a very eclectic community that there are a lot of folks that are struggling day in and day out just to make payments. And I think layering the cost of operation certificates annually, doing the inspections, things like that will raise other burdens. And the other conflict could also just be the lack of participation. We've seen that time and time again in other things too. So I worry about the cost that will be burdened on the health department and environmental health, trying to go after those, more staffing, more costs. I think in this time and age too, the one thing in your presentation, in the implementation, and this is my personal stake, I probably have a few people who agree with me. Funding should be first, adopting should be second. I think in this day and age, we've found budget after budget after budget being in crisis. I would love for funding mechanisms to be talked about first before we actually start implementing programs. That might sound backwards to some, but I really think we find ourselves underfunded and overstaffed, or vice versa, and then we're scrapping and deleting programs. So with that, we would just love to be a stakeholder at the table. I think we're not just our industry spokesperson, we're our clients, we're our neighbors, we are your constituents. We have insight that we can bring to you that we would love to share. So as you go forward, I just think keep that balance. We all want balance. I, for one, am a lifelong Thurston County resident. I love this community. I love everything this community has to offer. I don't want to see it ruined, but I want balance. And I do think we need all sides at the table. So thank you.
Thank you. And Paul? Hey, welcome.
I am Paul Oskowitz. I live at 9119 51st Avenue Northeast, up in the county, and I'm a real estate agent in town. I just wanted to bring it a little different perspective. I've been involved with real estate sales for a long time. I've stood on top of a bunch of septic inspections, a bunch of sewer inspections, and I really think you guys are looking at this the wrong way. We have a really good program currently. The septics that I experience, maybe 1 out of 20 need a repair. And it's usually a baffle, it's not something big. It doesn't really seem to be that big of an issue that usually people know and jump on it. The education that you guys put out, those classes are really good. It's a lot of my clients tell me, I tell them about them. It's a positive thing. The sewer systems are a complete disaster. You guys manage, I believe, 4 to 5 of your own. Your own requirement is to scope those sewer lines when a problem arises. So why do we need to look at our septic systems once a year when you don't even look at your sewer systems once every 10 years? You know, how much waste is going from those broken lines? In my experience, 4 out of 10 sewer lines, and that's just from the house to the street, have a problem. So how many thousands of lines are in the city, miles of lines are in the city, in the systems that you guys manage out in the areas that just don't get looked at? It just seems like we need to work on some other things before we only focus on this one area. So that's just my thoughts.
Thank you. Adam?
Hey everybody, I'm Adam Hunter. I have a septic system. Also, I do septic system design work in this county and some others. I think I would echo the thoughts that funding should be addressed up front. We shouldn't implement plans without some way to fund them. As a point of reference, Thurston County currently, in terms of repair fees for septic systems, this is environmental health only. Repair fees for a standard system are $1,780. That's assuming no other fees are associated with that. I was able to pull 14 other counties in the state of Washington, including larger counties, counties along Puget Sound, Pierce, King, Snohomish, Spokane. The average repair fees are $1,000. That's average repair fees. That's health department, that's soup to nuts, that's everything that it takes to go through the permitting process. To say that we have a funding issue is dishonest at best, I feel like. We pay the highest fees for repairs in Thurston County. Forget about new construction fees, like those are something else entirely, but I just wanted to focus on the health department here. You've got some great staff in the health department that work their tails off. The guys that we deal with on a daily basis, the folks that we deal with are really good. There's some sort of a funding issue here in Thurston County that drives the costs through the roof. That translates directly to cost to homeowners. Instead of looking for ways to be more efficient and more effective with how we do work, the impulse is always to raise fees. In our industry, we have to look at ways to be more efficient and more effective. I can't just go in and say, I'm gonna raise fees 10% or 15% or 20% this year. We've gotta be competitive. It's part of doing business in industry. I think the look to increasing fees is a major problem. Be more efficient, be more effective with the people you've got. I would also agree with Paul, who brought up the issues with the sewer systems. I would just say two things real quick. Sewer connections sound great on paper. In practice, most city jurisdictions have recognized that the cost of sewer is exorbitantly expensive and actually grant waivers to people in city limits from hooking up to sewer because of the cost. City of Lacey says if it's over 15% of the cost of the value of the property, they'll waive the requirement, let them hook up or put in a new septic. That's a consistent issue. And then you've got the maintenance and upkeep of the sewer systems. 6.3 million gallons directly sent out to Puget Sound in one incident. Thanks.
Thank you. Jim Bennett? Jim?
No, I didn't sign up to talk.
Okay. Does Jane wanna talk? Okay.
Good afternoon, I'm Jane Mountjoy Betting. I live at 4336 Lavelle Street Northwest. I do have a septic system. I am not covered by any of the county programs currently. I do my best to do a good job of looking after my system, but I very much support the septic plan, and that I think it's important for everyone to regularly have a look at their system. I think we need to look at more ways of making that happen. Our particular house was a family home over generations, and we were the first outside of the family to purchase it. So before, at that point of selling, it was the first time that actually had a septic system and a well. It was, there was an old spring house, and I think a cesspool was what they were using before. That wasn't caught through any of the programs because the house never sold. So there's more homes like that out there. There's other ones that people think they're doing the right thing, but really aren't. And so there needs to be a little bit more oversight in those. I do hope that we will move forward with figuring out the financing strategies so that the plan could be implemented. I also very much support the availability for financial aid because, as mentioned, it is expensive these days to pump and maintain a system, and not everybody can actually afford that, but it does need to be done. And I would say that what the services we're offering is really protecting our drinking water and protecting our other water resources and our public health. More so than providing a one-on-one service to an individual. So with that, I support it, and thank you everyone for your work.
Thank you for coming. And Jim Hunter?
I'm Jim Hunter. I'm a septic designer in Thurston County, also a resident of Thurston County. I've been designing systems since 1978. Things have changed a lot in that time. When I first started designing, you could permit, design and install a system for $1,000. And now it is more in the range of, for the average system, $30,000, right? There's a lot of change that has occurred. I would like to address two issues in the short time that I have. If public health is the issue, then what are we doing with sewer outfall, discharges of raw sewage with storm events? In one event, for a daily discharge in Puget Sound, 6.3 million gallons were discharged into Thurston County inlets, okay? That's from one. That would be the equivalent of 38,000 homes discharging directly into Thurston County shorelines in a one-day period of time. There are 58,000 septic systems in Thurston County, so that would be the equivalent of 67%. To say that, oh, we have to We have to monitor all systems in Thurston County. When this kind of thing happens on a regular basis, and this is just one example, it is beyond me. It questions whether public health is really the issue here, or whether instead it's control and generating additional revenue. Regarding the fee schedule, real quickly, I believe that the methodology used in establishing the fees that you have now and establishing the fees for the future is invalid. It makes assumptions. The hourly rate last year or this year was figured at $262 per hour. Let me double check that. $232 per hour. In checking what the salaries are, they are by multiples, they are substantially less than that. To say that that environmental health, for example, has to pay rent to be here when you have the Thurston County Courthouse and you have their own building that they own that is half full, less than half full. I would ask you to reevaluate how you have decided to charge fees, because I think that there are inflated numbers here based on a desire to just get to a higher level, when the problem is not that you're not charging enough money, but the mismanagement of current revenue, current incomes. Thank you.
Thank you for coming. All right, we're gonna go online and let's see a name, but the person with your hand raised, if you wanna go first.
Sure. Can you hear me okay?
Yep.
All right. My name's Erica Marbett. I'm the water resources biologist for the Squaxin Island Tribe. And the Squaxin Island Tribe has treaty reserved fish and shellfish resources in Thurston County. We're also a longtime water quality partner of Thurston County. I just want to let you guys know, as the biologist for the tribe, I support this robust septic system management plan and an updated plan, as well as a very robust program, because it protects access to safe shellfish for harvest for the Squaxin Island Tribe and all residents of Thurston County. I appreciate also this addressing of climate change in the plan. Just one specific example, septic systems that are very close to sea level are vulnerable to sea level rise, and it is very wise of the county to get informed and evaluate that topic early now, as soon as possible. Likewise, the marine recovery areas and sensitive areas that are proposed for designation, those areas are very important, and their water quality is very important to the tribe. So, yeah, that's what I wanted to say today. Thank you.
Yes, thank you for coming. All right, it looks like we need to do
Just ask if there's anybody else.
Are there any other people you wanna raise your hand or let us know you wanna make comment? All right. Last call, any other commenters? All right. So do we have any discussion or comment or?
You wanna close the hearing?
Okay, so we have no further speakers, so we'll close the public hearing.
I move to close the public hearing.
A second. All in favor?
Aye.
Thank you. Any opposed? Thank you all for coming and attending. Appreciate it.
Now we usually.
All right. And anyone wanna start discussion? Go from end to end or? You wanna start?
I was gonna ask Susan to talk about the Henderson Inlet program, because I believe that one is kind of what we're modeling, and kind of the successes of Henderson Inlet and kind of how that started, and maybe provide the board, I guess, just as a starting point.
Sounds great. I'm actually have Jean. She's the senior staff person that oversees that program. She can give you way more details than I can.
Good afternoon. I'm Jean Frost. I'm the Septic Operation and Maintenance Program Supervisor. Yeah, so we've had the Henderson Inlet Watershed Protection Area Plan or Watershed Protection Area since 2007. That is an enhanced operation and maintenance program that is funded funded annually by a tax assessment on people's properties, and that's requiring operations and maintenance inspections either annually or every 3 years, depending on what type of septic system you have. We have a notification program. That's how we started our self-inspection program, and we're able to develop our homeowner self-inspection program. It was originally created as part of a downgrade in shellfish growing area acreage. So there was restrictions on commercial shellfish harvest in Henderson Inlet, and that's really what spurred this action to address, one part of non-point pollution that was impacting Henderson Inlet. And so it has reduced, I believe, again, don't quote me, but I believe at the beginning, we were finding a failure rates around 13-14%, and now over time with ongoing maintenance and a robust dye test program of septic systems that are designated high risk, that our failure rate has reduced to 1 to 2% annually. And so we have a compliance rate of septic O&M of close to 85%, whereas in the county, it's closer to 30-some%. The presentation I gave last month has those exact numbers in it, as well as they're in the management plan. And so by requiring, regular maintenance, we're catching those small things early by providing education and outreach, as well as financial assistance to get those works done, as well as making those minor repairs that don't lead to big septic repairs that require the permits and replacements, that it's been really successful. And we've had improved water quality, and that acreage in Henderson Inlet has been reopened. Not all of it, but a percentage of it has been reopened to commercial shellfish harvest.
Continue.
No, no. I've gone out with our stream team and I've seen the data, and I've seen that there are, nitrogen levels in some streams that are through the roof, and I, so the work that you're talking about, I believe it's important, and so, I like that we're focusing on some of these sensitive, marine areas. I heard something in there, in some of there were great public comments. I heard some of the public comments were kind of like, well, what about this? That's not, to me, that's not just from an arguments perspective, that's not a valid argument. When you say, well, this thing is this, but what about what they're doing in the cities? If they're doing something wrong there too, we could talk about that as well, but it's a mutually exclusive thing. I'm just talking out loud.
Nope, I get it.
So I hear what the public is saying when they came up, but that's not a valid argument to say we shouldn't be working on this thing. I would love for you to explain to us more, and to the public more, about the self-inspection program, because if we're requiring, these on-site inspections, but we've got a program that certifies public on inspecting their own septics, then, that allows them to do this thing we're doing, right?
Yeah. So right now, we limit, so we have a self-inspection program, and we limit the type of systems, so those less complicated systems. So gravity, pressure, mounds are currently the type of system, and that's the majority of systems we have in Thurston County as a whole. And so those more complicated systems, we do require you to hire a septic professional to have them inspected. And so, yep, we teach, those that have the simpler systems, we do teach them how to do the inspection. They can come to the class, would say there are a percentage of people who go to the class and decide they don't wanna look inside a septic tank, and they do choose exactly, do choose to hire a professional. And we do again have a small grant program that is grant funded, that helps offset the costs for those that meet the income and like the requirements outlined. And so they could have up to $2,000 to either make minor repairs, those repairs that don't require a permit, pump, get it inspected, do some troubleshooting evaluation of their system if there are issues.
But it's fair to say that by and large, even in the marine recovery areas, the camera's zooming in on me when I talk, it's throwing me off. Even in the marine recovery areas, most people that would be able to take this self-inspection program and be able to perform the annual inspection on their own?
Yep.
That's cool.
Yep.
My next question, can you speak somebody to the rate setting methods? There was some public comment on that and questioning how those rates were set.
So, this for the MRAs or just in general. So in this is just the overall arching plan. So it's just really a framework. It's guidelines to inform the board and the committee of like, these are the overall recommendations. Implementation is the next phase where we'll talk about what are we gonna prioritize and how are we gonna fund it. So there are no rate structures or fees proposed in this plan. I mean, there's some guidelines of like, okay, if you wanna do this program, it could cost this much. And then we'll have a broader discussion with our community partners and the board. Again, what do we wanna priorities and how do we wanna fund it? So that's really the next phase of.
So the comments on rates and the comments on fees, and that's totally premature to the implementation of this, where we're at.
Correct.
Thank you.
And it's speaking to, just to piggyback, it's also speaking on our current fee schedule that's associated, like Article 1, our current fee schedule that's for like permits. And so the only thing that we have that's for the operation and maintenance of septic system is we have an assessment fee for the 2 marine recovery areas on the tax roll. And then we have what's called a renewable operational certificate. And so those are those higher risk systems, and that is set in the fee schedule. And so this plan, again, this would be for, if we went outside of those systems that we have current ongoing operational requirements for.
But no new fees are being proposed.
No new fees are being proposed with this plan.
Commissioner Forney, what the public may not know, maybe even some of the Board of Health members may not know, is that public health doesn't contribute any funding to the general fund. In fact, during this last budget cycle, some of the general fund that public health was receiving had to be removed as part of our larger fiscal challenges that we were receiving as a county. So this is not a situation where public health is being used as any type of proxy to try to bring additional funding into the county in some ways. And we are extremely thankful to the leadership of Dr. Freiheit for their work in adjusting their budgets, because not only was there a reduction in some general fund, but also they're experiencing cuts from the state and have had to downsize in different parts of public health and social services department.
Good point, thank you.
Tanzania.
Yes, I did have a question, so, no worries. So something that I did hear that kind of made me go, is during public comment, someone talked about a predictable conversion timeline. So I'm curious, do we have something like that? And if we don't, is that considered a best practice in the industry?
And septic to sewer.
Yeah, so the septic to sewer recommendation, as some of the public speakers mentioned, we do have pockets of septic systems where sewer is running by, maybe adjacent to, and development was, developed outside of that area. So it would, again, we'd need a feasibility study, we'd need to look at grant funding and what the funding opportunities are, because they are correct, it is expensive to connect these existing residents to sewer, depending on how far away they are from the line. So again, this would be part of the implementation and conversations about funding, structure, and what that looks like moving forward.
But to answer the question plainly, no, that there is not a plan that the county has currently in place.
Okay, so just to clarify, when moving into the implementation stage, that's when something like a predictable conversion timeline would be created?
It could be as part of the conversation, again, these would be conversations we would have to have with the sewer jurisdictions, so the city of Olympia, city of Tumwater, city of Lacey, because again, they're partners in this septic to sewer conversion. And so it could be a part of the solution, yeah.
Thank you.
But just to highlight what staff mentioned, in the unincorporated county areas, it can be extremely expensive and cost prohibitive to look at that approach. I'm not familiar with the current all the context within this county, but just generally in unincorporated areas, for homeowners, it becomes extremely cost prohibitive to do that.
Well, it's unincorporated, they can't.
In some cases, there are jurisdictional main lines that run fairly close. Not in all areas, but in some areas of the unincorporated, like in the UGAs.
But only in UGAs can they hook up to the utilities, right? I don't think outside of the UGA they're even allowed.
We have, there were like, I think of
Well,
Boston
to the,
Harbor.
okay, but to the cities, the city, to the municipal utilities. Wait, I'll stop.
Yeah, and unincorporated, yeah, they just can't.
Yeah.
Do you have something, clerk?
I do. And first, I'm just gonna weigh in that I think, where the urban growth areas are, where there's likely annexation and where there's already sewer mains running, that there's a possibility, but I can't imagine a time frame for creating sewer across the balance of the county. That's a lot of miles.
I don't think the GMA wouldn't even allow it.
Beg your pardon?
The GMA wouldn't even allow it, right?
Well, I think it's a moot point because of the expense of expanding a sewer network like that. So I think that's part of the interest in trying to create an updated management plan, is that we're very likely for the foreseeable future to have these septic systems. My question is about the interest in having more stakeholders involved in the implementation side, and maybe describing a little bit about what would that process of implementation and rulemaking and fee setting look like, and where would there be opportunities for more parties to be engaged in that?
Yeah, I mean, I think it really depends on the board's priority list, right? And what that looks like, what rises to the top. We might want to focus on doing more education outreach. We might want to focus on looking at MRAs, but that's more of a long-term solution, right? Where we're gonna have to have a lot of public input. We're gonna have to work with our community partners, our builders, our real estate agents, a plethora of stakeholders, and the board to see what that looks like moving forward. So, go ahead.
Yeah, Susan, could we consider in the work that you do, working with the Board of Health clerk to get the folks that made time out of their busy day to be here, which is super significant, in that they're wanting their voice to be heard and want to be part of the conversation, making sure they're in the loop of communications and outreach so that they don't have to come and find it. It's hard sometimes to find it in the government world, but that we're saying, hey, we're gonna have this conversation, or we're pulling people together. Because again, they've made the investment to come out.
Absolutely, yeah.
And if I may, I just also wanna just speak as one of the folks who was on the policy subcommittee that had several visits about this, that we looked at the marine recovery areas and the success there. And that I think really inspires wanting to broaden a similar effort across more systems. And to balance the costs and complications. We talked about what Susan just mentioned, the education and outreach that's already been ramping up. The self-inspection program are both supposed to be sort of counterweights to the burden that's getting on people to have to maintain their system. And also, for me personally, I just think that there's very little room for saying that it's too much of a burden, so folks should be allowed to continue on with a failed system. That's just attention. I'm not convinced that's big government. That's just poor stewardship
to my mind.
Guys have any questions or comments?
I have some thoughts. I don't know, let's see, so I was kind of thinking about the question that member Gonzalez Marshall brought up about the predictable schedule map. What I took down as far as notes when that was mentioned was establishing predictable schedule map on county capital facilities plan. And I don't know if I got that right. I was trying to type really fast and get everything. I see a nod in the audience. So when I'm thinking through that, I don't know that a predictable schedule map would be housed in the capital facilities plan. I think it would probably have to be housed within this OSS plan, right? I mean, it's not, they're kind of, I can see how they're connected, but like as far as on paper, they're not really connected. I don't think that would live in the capital facilities plan. Is that right?
I think your instinct is right, but it'd be good to do some research on it.
Okay. I can see why there's convenience there, but I know that staff in all different departments are working on all different things that all tie together. So it can take a lot of time to figure out where things belong if we're trying to put them somewhere else. But I do think that I think that this plan looks really good. I wanna thank staff for all the work you put into it. I wanna thank the subcommittee that reviewed this throughout the year. And I know it's hard to take into consideration all of the different factors when we're thinking about builders, developers, land use, housing needs, environmental protections, and you have to engage with all these different stakeholder groups. Based on what I've seen and what's in the presentation, outreach has been conducted. So I mean, the voices here today have been at the table throughout the process, maybe not in a structured way as far as like an oversight committee or something, but you do have embedded within the plan opportunities for improvement and oversight that you could, as staff, maybe develop into your own outreach programs that you're already doing. So I'm hopeful that based on the public comment we heard today, staff will take that and do a good job in implementing that however they can without needing to put it in the plan formally at this point. Unless we see after this is passed that something's not working, and then we could maybe revisit like what kind of oversight we need. I don't know. But I do appreciate that the plan includes a commitment to continued outreach. I think that's important. So as I'm listening to the comments today, I'm thinking, I hear a lot of valid comments. We need to take into consideration all of the different things we're working on, including our buildable lands report, how we're implementing that and how it coincides with this. But I think staff is on the right track, and I think that this is a good place to start. I think you've done a lot of work to get us to a place where I'm comfortable with the plan as it stands. I'm hearing concerns, a couple concerns from the public, but I definitely think you've done your due diligence. So I'm in support of the plan, and I just thank you for all the hard work you've put into it.
You guys have anything you want to say? All right, I think, is there a motion to adopt the 2025 Thurston County on-site sewage management plan?
I move to approve the adoption of the 2025 Thurston County on-site management plan in accordance with RCW 70.118A and WAC 246-272A. I'll second.
All in favor?
Conversation.
Oh, yeah.
Aye.
Sorry, I thought we already had conversation.
Yeah, technically, you're supposed to make a motion, make a second, and then allow debate.
Any debate? All right, I don't see
I
any
would
debate.
like, in terms of debate, I'm sorry, I would like clarity around the aspect of like we're talking loosely about working with stakeholders, and there are a lot of people at play, and I do have a high level of reverence and respect for you guys for the work that you have done here. But because this does affect so many other people and so many other cities and industries, is there maybe like a promissory in there somewhere that you guys would be willing to create an advisory committee for people to have that, not necessarily oversight, but to be similar to our board structure here, just people at the table that are all working toward the same thing?
Yeah, we can certainly look into that.
This is Ray. I'd like to make a comment.
Okay, go for it, Ray.
We have a motion and a second on the floor, and something like that would need further discussion and consideration. Would it be appropriate to I don't know that it's appropriate to amend the motion to adopt that very thing at this moment.
But I might jump in, and you did have the county manager's commitment that we would engage with the stakeholders that provided comment here today. So,
And I think
I didn't hear an amendment and you're.
Correct, I wasn't
yeah.
making an amendment, I was wondering, in terms of implementation, what is that going to be something specifically pursued during that process? And I do believe the answer was yes, looking into it, right, not promising that it will happen. I use the term promissory just to, you know.
And I think what we can do, because
And I'm in favor of that. Sorry for interjecting.
No worries, Rick, thank you.
Ray. This is a very important topic, and I agree with you, it affects a lot of our residents. And so we are not opposed also to bringing this back to do a work session with the Board of Health and to kind of talk about what the next step in the process or what the engagement process looks like. And at that time, we can get some input.
Yeah, so I'm in favor of everything I'm hearing and I trust the staff will do a good job with that, whether it's part of the motion or not. And I didn't hear an amendment, I just heard some good comments about ways to engage with the public, which is important. We don't want our builders and realtors and, you know, our tribes, environmental advocates, we don't want anyone to feel like their voices are not heard. I do appreciate the comments that we heard from the Squaxin tribe. That was very helpful for me. I think that like if we received an annual report to the Board of Health on data related to the failure rates, water quality trends, compliance rates and things like that, I think that would be a good way to kind of have some what people might call oversight, but really it's just a presentation so we kind of know what's going on. That might be helpful, I think, but yeah.
Yeah, I think I'd be interested in a work session, so.
That is part of phase 2.
Yeah.
See a lot more of it.
That would be
Yeah, when we do
implementation.
this-
Your wishes are coming.
Yeah, this is early, yeah.
And again, as part of that, we can make sure a list of interested parties are informed so that they can attend if they'd like.
All right, are we ready for a vote?
I think so.
I think everyone's okay. All right, so we have had a motion and a second to approve adoption of the 2025 Thurston County Onsite Sewage Management Plan. All in favor?
Aye.
aye.
Any
Aye.
opposed? And no one is abstaining. All right. Thank you, everybody, for the good suggestions, input, and participation. And we will make sure that we consider those things as we move forward in implementation. Right, so the next order of business is a resolution to adopt an updated techno. You already did.
Okay.
We closed the public hearing?
I didn't hear.
We had done it before we had
did
the
it?
conversation.
Okay,
Yeah, thank you though,
Yeah,
because you know
appreciate
my
that.
Robert's rules.
Yes, for your consideration today is resolution H-1-2026 to adopt a 5% technology fee previously approved by the Board of County Commissioners on October 2nd, 2025. This environmental health seeks that the Board of Health's approval to incorporate this fee into their fee schedule effective January 1, 2026 in accordance with RCW 70.05.060. The technology fee will support software maintenance and the transition to the new digital permitting system called Acela. Acela will improve efficiency, transparency, and customer service by allowing online application submittals, payments, and permit tracking. I will again turn it over to C. Long, Division Director of Environmental Health, to give more details.
Thank you. Adoption of this resolution will help to support a modern digital infrastructure and systems that are essential to support department operations. Revenue generated from this proposed technology fee will be used to support the maintenance and ongoing costs related to the joint technology applications in Acela. I would like to thank Community Planning and Economic Development, also known as CPED, for their leadership in developing and implementing the technology fee. CPED staff reviewed the Acela contract and believe a 5% technology fee will be adequate to support the maintenance and ongoing costs of our contract.
All right, any questions? So based on RCW 70.05.0607 and RCW 70.46.0311I, this is an item upon which only elected officials may provide a motion or vote. Is there a motion to approve resolution H1 2026, which allows staff to implement a technology fee supporting permitting services effective January 1st, 2026?
I would move to approve resolution H-1-2026, which allows staff to implement a technology fee supporting permitting services effective January 1st, 2026.
Second.
And so do just elected officials vote?
Correct.
Okay, so all elected officials in favor?
Aye.
Aye.
Any opposed? All right, thank you. Thanks, Susan.
Thank you.
Good luck, Susan.
So the next order of business is to discuss and approve a calendar of 2026 proclamations. And Dr. Jen Freiheit will provide us information on the proposed proclamations.
Yes, thank you. In your packet, if I could have you to turn to page 18. So just like we have done in past years, we provided the entire, each month of 2026, along with the far right column. It'll show you what we did as proclamations in 2023, then further in 2024, and then this past year. Again, we, in the 2026 ideas column, we just dumped a bunch of ideas. There are a few instances, like if you look at April on page 19, where Public Health and Social Services are giving a recommendation by highlights. That does not mean by any chance that you are forced or have to choose that. It was just for a couple of months, Public Health and Social Services wanted to give an idea of some that we felt were important to put forth. So for consideration there. So that continues through page 22 through December. And then we also on page 23, we added what the Board of County Commissioners has recently chosen for all of their 2026 proclamations. So there was very little overlap, and that's there for your positioning as well too. So I think as we started last time, we started and just went month by month. And you all can toss out your ideas and we'll record and collect that, if that's a permissible process. And we can start with January. For any ideas of what proclamations you might want to see in January.
I think National Poverty Awareness Month might be pertinent to what a lot of residents of Thurston County are going through. Should be something that we should be discussed and brought forth.
Support that.
Me too.
When does our time and count point?
Say that again?
Time. The point in time count?
The point in time count is the last week of January.
So I think it would go perfectly to bring awareness and volunteer opportunities for that.
Absolutely.
I just made a New Year's pledge to start donating blood. I did. That's not a joke. There's nothing weird. So I'd love to see National Blood Donor Month included. That'll help me with my New Year's resolution.
Force you.
Yeah.
You can start.
Especially if you get the bloodmobile here. It'll make it even easier for me.
Yeah.
We tried at one point based upon last year's donor day to get that, and it was difficult to procure.
We got a doctor now that can get things done.
Here,
Those
here,
people.
Here.
She can just take the blood.
Ah, there you go. She's got a bucket in her office probably.
And yeah, before we get too deep into it, are we gonna stick with 2 proclamations a month, or are we gonna try to limit it to 1, or?
Great question.
Do we have thoughts on that as a board?
I think 2 would probably be tops. Any more than 2 feels like a bit much to dedicate to, and then finding community members, actually being intentional about it, you know?
If we had 1, would that enable us to dig into it a little bit more?
At your direction.
Because
I know that was a discussion last January when we decided 2025 was to be more actionable, and it did become quite a time-intensive operation to try to make the things actionable.
So keeping on that theme with reductions in staff and, yeah, one, two max, I agree with that. One, if you wanna get into and have more, interaction and engagement with the community members, yeah, because, it comes pretty quick. And there's a lot of things to do and.
Absolutely.
Well, I like the idea of one, and I like the idea of being able to get more engaged and more into whatever topic that proclamation brings about. Would it be something that we could also bring forth speakers and community members that are able to speak to that topic too? Would there be a process for that if we know people who can, or who then the proclamation speaks to?
Yeah, and I think this was part of the discussion at the, was it the Education and Outreach Subcommittee? Of the process, and so we never did fully mobilize that sort of process, so how we want to look at doing exactly what you're proposing.
I also think, the reason we, in the Board of County Commissioners, we had this discussion too, and we only switched to one was because of the intentionality of it, right? Of what we're trying to promote, and so I'm in agreement with one. I'm wondering, the process that we follow, right, is that, staff will be like, these are the proclamations. Are there any recommendations of people that you think we might reach out to? Is that something similar that we could do here at the Board of Health of like, being like, okay, based on these, are there any recommendations from any of the Board of Health members where we can, recommend on speakers for?
I know on February, looking at National Donor Day, I would love for George Sharp and Diane Weaver to come in and tell their donor story, because it's a pretty cool story.
Yeah, we absolutely can do that, and I know the Education Subcommittee has some thoughts too that Commissioner Klaus has shared with staff about how do we create more engagement and really utilizing you as Board of Health members in your community role out there, bringing resources to the table and people to the table to help have those conversations.
Yeah, and if I could speak to that, but I saw Carolina's hand first.
Go ahead.
Okay, thank you. So, yeah, the Education and Outreach Subcommittee first started by talking through the strategic plan and some of the goals, and we identified this proclamation schedule and process as an area of opportunity for engagement with the community based on comments we've heard throughout the last year and a half from the Board of Health members about wanting, like being eager to engage more with the community and step into the role more and not knowing exactly where to put that enthusiasm or energy. And so we started off thinking about like, oh, let's have this ambassador program, and it was all, we were talking about different structures for it, and I talked to staff and then we kind of evolved into like, well, now we're doing the CHA, the community health assessment, and that's a perfect opportunity to do outreach and engagement. So we kind of pivoted away from creating this ambassador program to like, hey, we're already doing this CHA right now, let's use this as an opportunity to plug in. And that was, I think, really successful. I don't know, we haven't seen the results yet, but I'm hopeful that it's gonna be really important and eye-opening information when we see the results of the CHA. But throughout the year, I've talked with staff, and I even put together a communications plan for how the proclamation process could work if Board of Health members were to kind of be like ambassadors in the community to try to find or connect with different groups that are already working on these different items. And so we kind of decided, let's table the structure, and this was like, I don't know, maybe August or something this year. Me and the county manager and Assistant County Manager Cummings sat down and talked through the communications plan that I developed for the ambassador program. And we kind of decided there's a lot going on right now. This would be a lot to bring to the Board of Health. We're going through a lot of transitions. Let's do this very carefully. Let's slow walk it. Let's not just put it on the table as a brand new program. It will take staff time, and we didn't want to do that. So we talked through maybe like a process at the end of the year, which is now this current meeting, where we could maybe talk through what it would look like to have community engagement with Board of Health members going out and seeking out the guest speakers for the proclamations. And we just had so much going on, we haven't reconnected about that before this meeting, but it's still a thought that I have in my head about like, how can we take the burden off of staff and leverage the connections we already have as community members to kind of get more engagement and involvement and walk the guest speakers through the process. Cause staff don't always have time to like meet individually with each guest speaker and tell them how it's gonna work. And so we've seen some guest speakers come in and not exactly know where to sit. And if we had a Board of Health member who was already engaged with them and inviting them to come speak, and obviously coordinating with staff as well to make sure everyone's on the same page, we could walk the person in, sit down and introduce them and say, I'm board member, Klaus, and this is my colleague in the area of like, I don't know, transgender awareness, and they're gonna come speak on this topic today, and I could introduce them, and that would maybe make it more comfortable for everyone to kind of get settled versus having people try to figure it out when like the meeting starts. So anyways, I don't wanna like take up the whole time, but that's kind of just where we landed, and we never closed that loop of like, let's do it this way. But one component we did talk about was potentially having the Board of County Commissioners proclamation scheduled next to this one, so we could see what items are already being covered by the Board of County Commissioners to maybe help inform what we wanna do as the Board of Health. I don't see that in the packet, but that's okay, like I said, oh, is it in the packet?
Page 23.
Perfect, awesome, thank you so much. Okay, so that's here, so that's perfect, that's what we wanted to do, but yeah, I'm just kind of throwing that out there as like maybe potential opportunities to discuss next year, like what it could look like to have Board of Health members do some of that engagement and maybe take the burden off of staff.
So backing up a little bit, those are great ideas, thank you for that. Logistically, in the Commissioner's office, one of the things that's really helpful is when there is a leader within the group that knows whatever the topic might be, folks to connect with. So on that front end, logistically, it's really helpful if, so say like National Donor Day, if Commissioner Fournier knows a couple of folks or a good story he'd like to tell, having that warm handoff to staff is helpful. Like that for me would be the first part in terms of how do we lessen the burden on staff, because they're not gonna know everybody in the community. So the first step is for the board to decide each month which one you'd like, then perhaps assign a Board of Health member to be that, for lack of a better word, ambassador that can help make those connections. And then logistically, as we come in that day, we can talk about how the program works, but those first two steps I think would be really helpful.
And you said warm handoff to staff, and the second step was, I missed the second one.
The first step was deciding which ones you wanna do.
Okay, perfect,
And the second step was the warm handoff.
okay.
So going back to January, National Poverty Awareness Month, and then also National Blood Donor Month. I guess let's settle with one or two.
That's the first.
Yeah, that's the first one. I'm with Perla on one.
Yeah, I also think even taking it a step further back and not formalizing a second option, but saying if there's a speaker that that would, to bring in public comment would be amazing. Like that would be so cool to have public comment on donations, even if it's just a short spiel. Like if we have something we're passionate about and we have connection, we can invite them to just come speak to us and share their little, for 3 minutes. I think like the judge who spoke about men's health he stood out.
Yeah.
In the whole year of proclamations, he's one of them that stood out, and he was a public comment.
He's a pretty cool judge.
Yeah, and it's just, so there's opportunities for it to not be so formalized. We don't have to have a full, we don't have to have the 2 proclamations and have it be completely a lot of burden on staff. But yeah, I think that would be really cool to have more open public comment too.
Does somebody wanna make a motion for one per month?
I see a big smile on your face.
Well, I just wanted to keep the conversation going.
Yeah.
I'll make a motion for one proclamation a month.
I second it.
All in favor?
Discussion. I have a question.
Discussion. Sorry, I'm rushing.
Just wondering, because the Board of County Commissioners kind of went through a similar conversation, and we decided, like, we had a distinction between presentations and consent proclamations. So just for clarification, is the motion related to just any proclamation, or do we want to have like the one proclamation is formal and then we can have informal ones where we don't have to take a picture like the Board of County Commissioners?
Mine would be for one official proclamation, but the ability to go ahead and have people come in and speak to an initiative that we might move into official proclamation. So it really is about one proclamation, and we can always be open to the other.
Okay, I'm in favor of that.
Any other questions or comments? All in favor?
Aye.
Any opposed?
Aye.
Sorry, I'm losing my voice. Any opposed? All right, it passes. We will do one a month,
One formal one.
formal, and other people can come
6
for
informal.
public comment. Only one picture, one official proclamation for staff. Okay. So for January, we have 3 of us who are in favor of National Poverty Awareness Month. Are there any speakers to other ones?
That's hard. What is Radon Action Month?
It's acting on radon.
What?
Acting on radon.
Poisonous in the home.
Detectors.
Oh, okay.
I think we have a lot of radon here, do we?
I don't know that answer.
I think it's very regional.
We don't know what it is, we should probably do a proclamation.
Yeah,
We would certainly do more.
No, stop it.
Look them in
We must
software.
bring awareness to radon.
So refers to it as just raising awareness about radon exposure. What is? It's about the EPA and the American Lung Association. It's a colorless
I
and
don't think it's a
odorless.
huge issue in this county. It is in
Yeah.
Grace Harbor County.
Yeah, it's very regional, I think.
Should we go through and just pencil the ones we like per month, and then just, if there's any months with multiple, we can come back to them? Should we move on to February?
Yeah, I mean, is
I have a
everybody,
question.
okay.
Can I ask a question, just a procedural question?
Sure.
In case, and I don't know, in case it takes like a long time to get through, because this is a lot of different options and it's really, really hard to choose. I don't know if we wanna like come up with a process where maybe next month we come back and finalize it to give people the time to think about each option, or we can do it now, but I just know that sometimes these conversations take a long time.
Okay.
I have a recommendation, just because there are a lot of options, and maybe people need to sit and maybe decide just on January what we're gonna do, and then come back on January. Maybe send a list of your preferred ones for each month afterwards to the clerk, and then that way they can come back and be like, okay, these were kind of the choices of, Board of Health members, and then we can discuss a more condensed list
Yep.
of the
That's a great
options.
And next year, what we'll do is we'll get it out a month before this meeting so that you can have that, and then you can select your top one and we can come in to make those selections.
This sounds great. When we're not working on a biennial budget, we'll have more time to do it
Well,
earlier.
yes.
Would it be helpful to have February also, or are we good with just January?
Well, if we can get there February, that'd be even better.
Okay. Yeah.
Did we have board consensus that it's National Poverty Awareness Month for January?
So,
Yes.
Yes, yep. Okay, so we've got January.
If we did the proclamation in 2025, are we switching to a different one in 2026?
Sure.
Just to have a little diversity in the proclamation process?
I don't have feelings on that either way.
Last year, that question came up and you all decided yes for some months and no for other. There was ones that you wanted to repeat and there were
That's
ones you
true.
decided to go new.
For February, I like National Salute to Veteran Patients Week. I think that also ties back into men's health, and I think that's strongly encouraged.
I'm sorry, what which one?
The National Salute to Veteran Patients Week. There's a lot of good ones in February, though.
I think we have donor day on the table as well.
Well, I know, I thought we just
Donor Day.
decided we weren't gonna decide tonight.
Well, just for February,
Oh.
if, is it okay if we talk for February so they could get head start, the staff?
And staff was okay with that.
Yeah.
This is really hard for me personally. There's so many options here. I like the Salute to Veteran Patients Week, but I don't know that I would be like ready to say that that's the one if we're only gonna do one. I think that's a good one, but Race Equity Week stands out to me. National Black HIV and AIDS Awareness Day stands out to me. I mean, a lot of them do, but
So we,
I think we got our January, that's what the staff probably needed to get started, so we can go ahead and do the process for February through December. Send in your selection for each month to the clerk, and then we will dial that in and present it at the next meeting.
All right, so the next order of business is to review the 2026 Board of Health composition, and Dr. Freiheit's gonna lead us on that.
Yes, as you are aware, over the past several months, the Board of County Commissioners has been considering the composition of the Board of Health to meet the requirements of the new state legislation related to tribal participation. And starting on January 1, 2026, a newly determined Board of Health composition, which is on page 24, I believe, of your packet, will reduce the total seats to 10, as we discussed last January, and also for increased tribal representation. This will involve the decrease of 2 county commissioner seats and 2 community member seats that expired in September of 2025. This will also involve the addition of a rotating South County seat, an elected official from the South County, and 2 additional.
We said we were doing 4, we do 3.
for community or
it's reducing by 2.
Or commissioners.
I thought we said
3.
Yeah, there's
Just
been-
really quick, with you guys' side dialogue, are you referring to a county commissioner conversation, or are you referring to what we decided is in the Board of Health?
A county commissioner
Okay,
conversation.
thank you.
And this will also involve the addition of a rotating South County seat that's an elected official and 2 additional tribal representative seats, one for Chehalis and one for Nisqually. That will also account for the RCW 70.05.3030, the 3 grouping requirement of the community members, which we sort of do on the back end to make sure that we're always meeting that. This will allow inclusivity for the tribal nations, and we appreciate the opportunity to be inclusive to all 3 of our tribes within Thurston County. So yes, and the proposed structure, or the new structure is on page 24 of the packet.
So again, thank you for that. So in response to the RCW, as Jen said, the Board of County Commissioners reduced their seats from 5 to 3. Commissioner Grant and Commissioner Mincer will be stepping off of the Board of Health in the new year. And we are responding to the RCW by increasing our outreach to the tribal members, 3 different tribes of our region, to allow them, to provide them seats on the Board of Health. Along with that, given we didn't have a clerk of the board, we recognized that we had terms expiring in September. And once we saw those in the past couple of weeks, we reached out directly and quickly to Board Member Nelson and Board Member Zinzali Marshall to let them know that those seats would also be sunsetting. So the new composition in the new year, after we reach out to the tribal partners, we'll get back to the board and have a newly formed board in 2026.
I have a question.
Oh, and Dr. Harvey, as you know, is also stepping down from her role on the board.
So Perla is staying on. Who is the other?
It's
Community.
Board Member Canedo.
Canedo, okay. I knew, I was like, I'm forgetting.
And I have a question. The rotating city seats, 2-year cycle, is that in statute or is that something that was decided here? Or why 2 years as opposed to 1? I'm just curious.
It's not in statute.
It's not in statute. That was always what was in, when I came in, that was decided long ago.
But it was discussed with county commissioners about the time it takes somebody to get in the Board of Health, get acclimated, and then a year goes by and they have to switch.
Yeah, I can see that.
With the 2, one for South County, one for the Northern County, it gives them an opportunity to get more vested.
That makes sense.
So, as a member who's getting ready to lose their seat, it's been so wonderful, first of all of you, if I'm unable to stay, but I do have a lot of questions around this. only because the composition discussion as well as strategic planning discussion has been put off for months and months and months. We kept saying, oh, we're gonna talk about it at this time, et cetera. So when we initially made the decision with the guidance from the commissioners, about the composition, once we were told that an RCW from the state was coming down and we were gonna have to make that change, we also said that we were gonna talk about what that looked like. So it feels a bit abrupt, that this wasn't, like, could have been discussed prior to, and it's like, I just have so many questions, like, is 10 the absolute number that we have to have, or could we have 12? And we talked about reaching out to the tribes. I don't have clarity on whether or not we have people who are impending, so are we gonna stay seated until we actually have new members to come and take over those seats? There's just a lot that has not, right, I understand, like, people just coming in and there's just so many things, and we're doing our best to really make the Board of Health strong, and going through these kind of bumps and these transitions is a part of that. But I feel like this conversation was supposed to have been had like 6 months ago, and it hasn't, and now it's like, hey, your seat's up. So I would just love to have some clarification around whether or not we have any contact with the tribes that are supposed to be coming in, taking the seats, and are we just gonna hold the seats until they come in and or until that happens? And then whether or not, because we have not done strategic planning, is there still opportunity to change the composition?
I can answer one aspect of your good questions, and thanks for the perspectives. The delay in the conversation was in regards to the public health staff waiting for the state to provide clarity on the rulemaking. And at the same time, we also needed to update our attorneys and make sure that we all were understanding it correctly. And Dr. Freiheit had been reaching out to the state. I know because we were pinging her like, hey, have you talked to the state? They're not ready yet. They don't have the information yet. And so we were able to do that just several weeks back when they came, or it was a virtual conversation, have our attorneys there, and they were able to talk through the, here's what this does mean, here's what it doesn't mean. And so with the timeframe that it got so compressed, this conversation also had to go to the Board of County Commissioners fairly quick. And so ideally, we would have got that rulemaking, Dr. Freiheit wanted it months ago. And was asking, I think, in the early part of the year, yeah, so.
And what
Of course, sure,
And what
yes.
finally the state said was, you can proceed without whatever we need to provide you, just keep it go. But by that time, we needed to get it in front of the Board of County Commissioners, so that's the
Right.
compression that happened.
And complete understanding to that part. What I would say though is that that is not necessarily directly related to why we as a board did not revisit the composition conversation like through strategic planning, right? So we still could have done, I'm just, it feels like we could have had a more robust or clarifying conversation. Like I would have loved to have been expecting this. So with that, it's like, oh, okay, so then there is no more conversation, or I guess that's where the confusion comes from. Like there's the state and the communication with the state and rulemaking, which we don't have control over, but we do have control over how we communicate and how we operate as a board internally, which has been a bit fractured, right? I mean, we can all, I think, agree with that fairly, just with changing in staff, new people coming on and off, and then something like this, such a large conversation, the composition of the board not being clear for everyone.
Yep, Commissioner Klaus.
So I guess I just wanna start by saying I'm disheartened by this process and how we got here. Hearing that members who had their seats expiring just found out that they will be no longer representing on the Board of Health, like really hurts. It hurts to hear that because we haven't talked about what the process would look like. I think members and Zolly Marshall is completely on point. We haven't, I mean, the Board of County Commissioners has had discussions, Board of Health has had discussions, and I've checked my email to try to figure out, because we've talked about so many different iterations as we've been waiting on the rulemaking, so I totally understand why staff has had to cram it all in at the end. Cause I see an email from October 30th where the Board of Health configuration chart that we're looking at now actually was different and still had 12 members. And so then we changed it. So it's been hard to keep up with the process, but hearing that board members are already being told that their terms are gonna sunset and this is their last meeting and they just found out, feels completely wrong, especially when members in Solly Marshall has been one of the most engaged members asking for us to push through our strategic plan and still being respectful and mindful that staff have barriers because of turnover and a lot of work on their plate. Like, I've heard a lot of really good insight and great questions from all the members here. So just hearing like, oh, a couple community member seats are gonna be eliminated right now, without figuring out as a board, like, do we want to do interviews for the positions that still remain? Do we wanna just do it based on the terms? It just doesn't feel like we're doing this in a fair and equitable way. So,
I don't think you could do that. I don't
Commissioner
think you
Mejia had her
could
hand up.
unseat people.
well, that's what we're saying we're gonna do, isn't it?
No, it's different, but it's.
Gotta go. Commissioner May.
Yeah, so the Board of County Commissioners had this discussion and staff did provide the information about the expiry dates, and all commissioners voted on this new model, on this 10-member configuration. But also in looking at, we're a little bit different because we're a 5-member commission. But in looking at other similar sized counties that have the same component of a Board of Health that we do, because there's also Board of Health districts, there's different components of Board of Health. Not every Board of Health is the same. And so trying to see which other ones were similar to ours, right? And talking with Jamie from Wasalfo, and I think the conversation that the Board of County Commissioners had was, what is the right configuration at this time? And it's something that, you know, we even had the conversations about even county commissioner seats and cutting 2 of those seats. Because in a lot of Board of Health, their full Board of County Commissioners serves on their Board of Health. And so for us, cutting back two additional seats, right? Like that's, you know, something that we were doing, like we talked a lot about that. And, you know, we're open to revisiting the agreement that the Board of Commissioners came to was, we're open to revisiting this at the end of next year, see how it's working, see if at that time we need to expand. But just with all the different changes that were happening, we decided to keep it at 10. And that was the conversation, just so we could, you know, be able to give, like, in all of the transition, just start there and then revisit at the end of December next year. So that's kind of how we landed on the 10-member Board of Health conversation.
And Commissioner, quickly, if I could ask, and you're speaking to how you came to this decision recently, right now, that's been being shared in this meeting. You're not referring to the composition choosing that we had done as the Board of Health, and then it took to you guys later, right? You're talking about right now kind of having that, the rulemaking be finalized, staff coming to you and saying, hey, a decision needs to be made. So that's pertaining to recently.
Yes.
Okay.
The question about the tribal nations inclusivity, you're asking about those seats. My understanding is that the first year, those seats belong to those tribes essentially. So it'll be, you know, it'll be presented, you know, they'll be able to provide whoever they want from as their representative. But after the first of the year, those seats belong to them.
Turn
And
into-
no one else, like,
Right.
we couldn't have remaining community members sit in lieu of.
Right, and thank you for that clarification. So that brings up another question in my mind, because the language that we're using in this conversation is, well, we're losing these 2 community seats because we're bringing on these tribes, as if my seat directly needs to be handed to a tribe member as a right, but that's the language that was used in an email I received, and that's the language we have used in this conversation today. So the community seats are separate from the tribe seats then. So just to understand clarification, because there's been a lot of conversation. I know that at the end of the day, the Board of County Commissioners has an immense responsibility having to make these decisions around composition. It's not easy when somebody comes to you in the 11th hour and says, hey, a decision needs to be made. But I would ask you to consider how that trickles down to the people who it's directly affecting, right? The lack of process, the lack of procedure, the lack of communication. That's why I use the term fractured, because that's how it has kind of come off. So yes, I am very happy, and I feel like I've grown so much as an individual, as a public health professional, just being a part of the board. And I will continue to say I feel like this is such a dynamic group of people, and that there is a lot of things that could be being done, for lack of a better word, in a more communicative and equitable way. And literally finding out that this is my last meeting is, it's shocking.
Okay.
I have a little different situation in that I was ready to rotate off this board some time ago and was asked to stay until the seats could be filled. And that's just because of other professional responsibilities that I have. So I don't have any angst, and I have really learned a lot. This has been a fabulous experience for me. I do have a concern looking at this that didn't dawn on me until I saw it. I applied to serve on this board because during the pandemic, this was a 3-person board, and none of those 3 people had any connection to healthcare in our community at all. When I look around this room right now, or when I look at this list of board members, I believe that more than half of board members, whether you're here because of it or not, you have some lived experience in the healthcare profession. And I just wonder what that's gonna look like going forward, because I think it's so very important to have that representation. And I'm not saying you're not gonna get members who also have healthcare experience, but I'd surely look
Debating, and I've spent a lifetime in
I know, I was
emergency
counting
medicine.
you, I'm well aware. But I just would put that caution out there. And then the other thing is that I've had in other endeavors, some situations where it has been, for whatever reason, difficult to engage tribal members, right? And so, but I think I heard the answer to this, and that's if a tribe's not able to find somebody, that seat sits empty until they do.
Yeah,
And even if they, okay.
that's one of the things that became very clear in the rulemaking, were those, based on, legislation about those 3 seats.
This is per the state.
Yeah, it's not, it's not.
The tribes moving into healthcare has been a huge thing in the last like 5-6 years. So they've really grown that aspect of their, their communities.
And I might jump in, because I wanna make sure, thank you both for the comments in terms of the composition and the way that we use the language. So I wanna be more careful with the language. So in terms of the composition discussion, thank you for the good conversation on that. I wanna clearly provide a mea culpa from staff on both sides. We kept you in the seat longer than you maybe wanted to because we
No, I
didn't
agreed, it was fine.
know the expiration. And we didn't tell you soon enough because of the expiration. Not having a clerk of the board has been difficult. So that portion of it, that's on us as staff. As soon as we, sorry Melanie, I wasn't saying this about you. As soon as Melanie and Jen sourced that, we immediately got on with the county manager and discussed it with the chair and vice chair and how do we communicate that. So that one's on us, and you're 100% right. We should be more careful than the way that we share the language, because those things are, while they're related in timing, they're not related in terms of the decision-making process, so.
Yeah, and we, learning of it, direction was, hey, Dr. Fried, reach out and communicate, and so, it is tough because those 2 things are unintentionally colliding, in an environment where we also got pushback, to the rulemaking and the county commissioners. It has been an extremely tight agenda, because of the budgetary situation that they're working through. So finding time on the calendar to have what was a pretty lengthy and very thoughtful conversation, it just, we hear the call to do better, and we receive that.
Definitely. Yeah. And how far along was the seat? The seat was already in the expirations of the 2 seats. wasn't,
September.
question.
was, you came into a seat that was already.
Oh, I see what you're saying, yeah.
But I can't remember if that's that
Yes,
accurate.
I can't remember the exact number of months, but yes,
Maria Williams, yes.
member
Yeah, she
Zanzelli
took-
Marshall was chosen
Took
to
over
fill
a
Maria
seat
Williams'
that we were
seat.
seated on, the three of us
Right.
at that time,
Yeah.
so. Yep.
Look at our charger, sorry. I do have a question.
Okay.
So this iteration, both iterations, the one we're looking at now and the one I have up from October that is no longer what we're considering. The one from October says 12-member board, this one says 10, but both of them have the same blurb at the bottom about RCW 70.05.030. With the 3 required categories. So I'm just wondering, how does the makeup reflect those 3 categories? Wouldn't we wanna have 3 community seats that reflect each of those categories, or how are we fulfilling that requirement?
Yeah, and that's something that more or less happens on the background. We've never been audited per se on that. However, we always wanna make sure we have that. So for example, when Dr. Harvey stated she was stepping down, we knew we had Perla as a nurse, so to be able to fill category 1, because category 1 forces that we always have a provider, a clinician on the Board of Health. Category 2 is anybody who's had lived experience, which you could argue anybody almost has, or a consumer of public health, somebody that maybe, grew up using WIC or, whatnot there. And so there's a broad variety of things happening there. And then for number 3, that's where member Gnadl fits in as far as being either a member of a CBO, nonprofit business community that's representing that sort of faction of the community and that aspect. So we will always make sure that no matter what the composition is, that we're meeting those 3. It doesn't necessarily have any reflection on who applies. That's sort of in the background that we make sure those are met.
Okay, is it allowable to have an additional community seat so that we can have 3 community seats, 3 tribal seats, and 5 elected officials?
Commissioner, that's effectively what the county commissioners' discussion was, that you were part of course.
Right, yeah.
Yeah.
Yeah, and no, I apologize for not being able to recall every conversation. Like I said, we've had conversations here, we've had conversations with the county commissioners. We talked about it in our one-on-ones or two-on-ones, upstairs, and so a lot of different conversations. It's hard to remember which ones happened when. So I do apologize that I can't recall all of that, but as I'm looking at it now, sometimes it doesn't hit me until I see it on the screen and we're sitting here in public and we're talking about the impacts, and then I'm like, oh, okay. Here's another consideration that I maybe didn't have a month ago. And I'm just wondering if it's allowable to have 3 community seats, 3 tribal seats, and 5 elected seats.
Per RCW, there has to be an equal number of elected officials to community members, and per the RCW, the tribal members are considered community seats.
So we would need 1 more elected official if we were gonna do that.
And in fact, at one point in time last January, we were talking about the South County seat could be anybody, and now it basically has to be an elected official in order to do that balance.
I do have a question. So for the community seats, like I joined others in saying this was a big surprise. Was there an option to discuss how those community seats would be filled within the community members who fill them?
That would have been the discussion that we were supposed to have as the board multiple times that continued to get pushed back even prior to the RCW coming down, right? So I think that's where my angst or my surprise comes from, is that there has just been a lot of difficulty kind of procedurally, internally. And if I may, I will be totally honest, I think during that initial conversation that we went over the composition originally, I thought that was the purview of the Board of Health. I didn't realize that we were making recommendations for the county commissioners. That was not clear to me during that conversation. And that could have just truly been me being new at the time. So that's helpful to think back and be like, oh, okay, that makes a little bit more sense now. But yeah, just not, to try to answer your question from my perspective, yeah, that would have been a conversation that we should have already had, essentially.
That does feel like a key point to me too. Like if we're gonna have 2 community member seats, I don't think maybe that the most appropriate decision is to just eliminate the 2 seats that have their terms expiring. I think it could be.
It's 3 seats, right? Eliminating 3 seats.
Okay, we're eliminating 3 seats.
Yes.
Okay, so I think there should maybe be a broader conversation about the 2 remaining seats that are still here and how those are filled versus just eliminating the ones that have expiring terms, if that makes sense.
So just as a reminder, staff was providing options to the Board of County Commissioners, and I think Commissioner Mejia earlier stated that the board had decided this composition and then to look at it after the year to see how it was going. If that's, I think, kind of the question that you're asking, but it's not to us as staff, it's to your seatmates on the commission.
Well, it's not necessarily the composition I'm arguing, it's the process by which we decide who will be filling those 2 community seats that are now going to be there. So I'm not arguing the composition necessarily, even though I do think we could add, I think that it would be good to have another community seat, but I realize that would cause, we need balance on both sides, I get that. So I'm not arguing the composition, but I'm just thinking like the process by which we fill those 2 seats, do we really wanna do it based on expiring terms, or do we wanna have a more holistic conversation with the whole group and say, who wants to stay, who wants to, who's ready to step off, and do it that way?
Excuse me.
Wanna say something? Commissioner Fournier.
I don't think that's fair either. And I don't, like typically when somebody is placed in a seat, that's theirs, right? That's their seat. So, Member Newton, that's her seat until her term is up. And we have no right to kick her out of it. And I shouldn't say your name, but like.
No, it wouldn't be kicking out, it would be asking within, like, do I have agency to decide for myself if I wanna stay on or not, knowing that the number of community seats are gonna be reduced.
Yeah.
So that wasn't a conversation that the community members were part of, the community board members.
You could also say that would be putting undue like influence and pressure on you to do something, right?
I think
I wouldn't
see it
wanna
that
be in a
way.
position either where
As-
we're like, everyone looks over at Perla, do you want to stay in this, like that?
I think I think being part of the conversation is important.
Yeah, I hear assumptions being made about how other people would feel when we're hearing right now from Member Newton that that's not how she sees it. So I just think we should be careful about assuming other people's perspectives.
No, I'm saying that I'm not, like, in my mind, when you appoint someone to a seat, I'm not making assumptions about how people feel. I'm saying how I feel about when you appoint someone to a seat. That is their seat until they want to vacate it. And I don't know that I have a right to, to say to them, I think somebody else is more appropriate. So like that,
That's not what I'm
sorry.
Just a clarifying question, so if this wasn't the situation, but somebody was just going to resign for personal reasons or whatever, wouldn't there be a process rather than just appointing somebody whose
Yes.
seat is termed out?
And that's, I think, Lynn, that's a great question. I think we've heard some good feedback. What we can do is, sorry, I was like, those doors should be locked. But what we can do is take this conversation and maybe quickly meet with the chair, vice chair, and see how we can facilitate the situation with the 2 community seats and what that would look like for the Board of Health. Because I think there's a way for us to facilitate that conversation in light of the fact that it was not by design that, information was delayed in coming to the county that then put the commissioners in a spot where they had to make a decision. And now here we are with, at the same time, with 3 people, with 2 expired seats and 1 person stepping off the board at the same time. So maybe if we can synthesize those and come back and figure out how do we have that conversation about what do those 2 community seats look like to get perspective and input, that can be helpful.
I think that would be great, yeah. And I apologize for like being part of the pause of this, but I'm just like, as I hear the impact and see it, and we're in this group conversation, I'm realizing the impacts in a different way than I did when we were upstairs talking about it and looking at this paper. So I would really appreciate that if we could do it that way.
I don't think that there's any apology necessary. This is a situation where just dynamics outside of our control pressed it all into the end of the year. It feels like that's a theme right now. Everything's getting pressed into the end of the year. And this doesn't happen very often. If it wasn't for the state legislation, we wouldn't even be talking. We'd be more looking at, oh my gosh, we gotta renew a seat, and yours expired, we didn't know that, and you've been waiting to step off, so we're ready to transition that. It just makes it a little bit more
difficult. But I think there are some great perspectives that need to be looked at and worked through to Member Perla's point about the agency of saying, well, maybe we need to do an inventory of who's interested in continuing on to see if that shuffles anything.
But we also, with the makeup, you know, the three of us potentially, that our terms expired in September, we have a healthcare and a community person, whereas if you popped off, we wouldn't have a healthcare.
Yeah.
And any change would require an appointment by the Board of County Commissioners, not by the Board of Health.
And that's what we want to process, because to Lynn's point, there's a process and we need to kind of stick to the process. And part of this conversation is difficult because in the transition of the staff, we didn't stick to the process, and you know, our apologies for the impact. Absolutely.
So, and being respectful of time, I also wanted to make sure that you knew we had something positive to provide to the two members that the staff wanted to give as a thank you. If that's okay. Chair.
Yep, definitely. So we wanted to acknowledge your service and your collegiality, and staff also wanted to thank you for all that you've done.
Yes, first for Lynn, a certificate and a plaque as you worked through COVID and filled a vital role in the seat as we moved from such a small number to a large number. Thank you for all of your service to this county and to this Board of Health. And yes, Tanzania, for your service and for providing some direction and input on how to move the Board of Health forward, that we will continue to carry on and work through all of that as well too. Thank you so much.
And I will say, Dr. Frahe this afternoon shared with me that they are also working on some recognition for the two commissioners that are stepping off of the Board of Health as well, so.
Twice as big.
Maybe a gold chain.
I was a member of the Board of Health.
You get a t-shirt.
Yeah.
So just to clarify, these are congratulations on your term expiring, but not necessarily goodbye. Goodbye. We're gonna talk through it, but this makes it look like it's like, I know Lynn's stepping down, but.
And subcommittees are always open and always.
Applications.
Applications when a seat opens.
So can I ask a question? Like, I'm hearing that we're gonna talk through what this transition could look like, but we do have seats expiring, so when we come back in January, who's gonna be here? Are we gonna move forward with the presented structure, or are we taking another look at it to figure out how that's gonna work?
That's a great question. So the structure is approved by the county commissioners. That's what we're moving forward with. I think the question at hand is looking at the implementation to community members. Commissioner Fournier is right that any decisions or even any recommendations that would be made would have to go to the county commissioners. And I think there's been some great comments about needing to keep that health component on the Board of Health. And so those are some things that we'll try to synthesize and reach out to the current chair, vice chair to figure out what our next steps would look like.
So in the new year, we'll be smaller, and the conversations will be like the county manager says, how we fill those two community seats and the outreach on the three travels. We already have one, so the outreach on the other two travel seats. That'll be one of the first conversations that we have.
And I'll be here until there's a new chair in January meeting.
Okay.
Yes, at the January meeting, we will have the vote, the election for chair and vice chair.
Will Councilmember Gilman be here, or are we rotating to a new city?
It's the second year of Olympia next year.
Okay, that's what I thought.
Yeah.
So how are we gonna have a conversation about filling two seats, community seats, if we're gonna already have those two seats filled?
Well, the seats are currently filled. The conversation we're gonna have is processing the comments, the very helpful comments from the Board of Health, and seeing what our next steps are, and then we would communicate that out
to the Board of Health members.
Okay, I wanna just say I'm a little weary of the process moving forward because while I respect it and agree with it, we have had conversations where we say we'll communicate that and then it's not communicated, and then we're hearing today that it was communicated at the last minute that folks would have to be removed from the board, so I am feeling uneasy about where we're leaving this.
We're also appointed to a chair for a particular time, and part of, I also am terrible about tracking that myself, but I did recognize kind of in September, I'm like, I think my term is expiring, and we had to deal with that. And so, I mean, I knew when I was appointed for, so I don't know, it's more complicated for Tanzania because she filled a seat, and so that probably was more like when does it expire, but.
Yeah,
Also, your uneasiness is definitely registered. We'll quickly look to loop in with Chair, Vice Chair, and there will be something that comes out from Dr. Freiheit about what our next steps are, what that discussion looks like.
Okay, that would be great, and if it's appropriate, I'll defer to staff on whether or not communications are appropriate this way or the other way, but perhaps that communication could come forward to the full Board of Health versus just to the county commissioners so that everyone is in the loop.
That would be our plan.
Okay, perfect.
Yes.
Thank you.
I need a little bit of clarification because I was under the understanding, and again, the communication is concerning, but I was under the understanding that the community seats kind of laid victim to the new legislation of participation of the other two tribes. So can somebody clarify for me that the other, how many community seats do we have? Is it just the two that are going to be filled by the tribe, or is there some in the balance still?
Ray, are you able to see the slide?
Or page
I
24
cannot.
of the
No.
packet.
Okay, did you hear Jen, page 24 of the packet?
I can refer to it later, but I can't see it at the moment. Sorry.
That might help answer your question.
And just for clarity, it is 5 community member seats. 3 of those 5 community member seats will be filled by tribal members.
Okay.
They're still,
thank
by
you.
RCW, they're still considered community members.
Yep, I understand that. I was just wondering, with the 2 other tribal seats, how many community seats are in the balance to be filled?
The 2 other tribes.
Okay, so by legislation, we need to make room for the other 2 tribes.
Yes.
So it will be a discussion to be had with the commissioners if they want to change the composition and the balance of seats to be on the board, because you have to have an equal amount of seats.
Yeah, and the board has already voted on this, Ray.
Yeah, so.
Yep, I'm aware of that, but there's suggestion of and again, this is a presumption because I'm not there, I'm listening, to consider expanding community seats, which would create another expansion of adding commissioners back on board. So I think I'm squared away.
Yeah, I would just clarify that's not necessarily what is being discussed, expanding the Board of Health. What's being discussed is how do we talk through the comments about the additional 2 community seats that are not tribal members, understanding that in the intersection of late information, expired seats that weren't noticed and some of these other things, is there any, and the process we have to follow, is there any consideration that we can make in that, and then getting that back information out to the Board of Health?
Yeah, understood.
Right. Ready to head toward the ramp? Okay. So one order of business that we didn't get to was the health officer director's report, which is in the packet on page 21 if you have any questions.
Okay.
Hint, hint.
Or hint.
County building is now closed.
Then feel free to direct them to Dr. Fryhead or Dr. Valona. And any questions for them? Okay, and again, welcome. We're so grateful to have a health officer here.
You're here.
And-
Up again.
And then there was no open discussion items submitted, so may I have a motion to adjourn the December 9th, 2025 Board of Health meeting? Second?
Second.
And probably no discussion on this one. Okay, all in favor? Aye. Any opposed? Nope, okay, we're done. Thanks. I know you are. For having a caring heart.